Welcome to Module 2, Chapters 4 and Chapters 5. Here are objectives of what it is that we're trying to understand. So in this module, we're talking about buyer behavior and research. So basically what we're talking about here is what do our customers want? And how did they make their decisions? And so one of my simple ways of looking at this is, how do we know what our customers want? Well, we ask them. But of course, it depends on the customer that we're talking about. And so how we might buy drugs at a drugstore, consume hospital services, choose a provider, and choose a health insurance company are all a little bit different. So we're going to look at what things might affect those different decisions. So we're going to look at this decision-making model. And so how do consumers decide what it is that they want to buy? And so first they recognize they have a problem. They do an internal search and they do an external search. So external are factors such as relative benefit to cost. Locus of control, what that means is if you have an internal locus of control, that means that you're someone that's making decisions for yourself. External, you're someone that's influenced by external factors. But of course, we look at the perceived risk in buyer behavior as well, and actual versus perceived. So once again, perception is reality in the marketing world. But we also look at what are our choices in here? Are there things that we can do instead? Now here's another term that may be new for you: cognitive dissonance. And so what that means is that you have mixed feelings about things. And so this can kind of create a struggle for you internally of should you do A or B, because part of you really feels strongly about A. Perhaps you have guilt factors that are coming in that are pulling against that. But that can also be in this post-purchase evaluation, or buyer's remorse, as we sometimes call it. So what how we make decisions is somewhat dependent on how high or low the involvement is. So we're going to look at some things that are examples of that. If you are buying a house or a car, a big high ticket item, then obviously you're going to do a lot more research. You're going to take longer. There's a lot more involved than just going to the mall and buying some clothes. So that the degree of effort really makes an impact in that. So some other things to consider: brand loyalty. Now, if you are a brand loyal person, you'll know what I'm talking about here. Do you always drive Toyotas versus Hondas, for example? You Charmin and Bounty people know what I'm talking about here. But think of something like open heart. So open heart surgery, is there brand loyalty in that? Well, can we create that kind of buyer connection in healthcare? So an example of that may be these high involvement type decisions. And so if you need open heart surgery, or let's say you have a brain tumor. So in our state, if you have a brain tumor, there is a healthcare facility in the state that is known probably internationally for this, and that's Duke. And part of this was helped to be emphasized when President Jimmy Carter, who did have a brain cancer, went to Duke, tried the new immunotherapy stuff, and was, and I put this in quotes, cured. So, so we can do this in healthcare. And using Jimmy Carter and highly publicizing that is part of how we create a brand. So we're going to talk about branding a little bit as well. Now, there's some things that are limited decision making. I mean, do you buy generic aspirin? Do you buy St. Joseph's aspirin? And so those would be low decision purchases. And so here's just a chart that kind of outlines this of is the decision making high or low. And so if it's high, then you might have an extended period versus routine. Now, how do we make decisions? What's involved here? And so there's a lot of psychological factors involved. And so many of us, which included me, did not really study psychology. So the more that you understand psychology, really the better you can be as a marketer. So the question is, why do we do what we do? So this discusses that there are a number of influences and ways that we measure that. Part of that, there are a lot of socio-cultural factors that come into play as well. And so your family, there's a lot of information in the text about the family life cycle, but the family or our reference group, our culture, our subculture have big impacts on this. So for example, let's take something like, do you get colonoscopies or not? They're expensive, they're kind of inconvenient. If you are a first-degree relative of someone that's had colon cancer, you really should get this done. Mammography would be another example. Who gets mammograms, who does not? And so what are things that impact that? And so I'm going to talk about that a little bit more in a minute. This is some interesting stuff. This is actually a book, Values in Our Culture by Paul Ray. And it kind of divides the United States into 3 different groups. And look at this. And which of these really describes you? You know, are you a traditional type person that firmly entrenched in family, community, church? Your religion is important. Freedom is important. This may be ringing a bell in this most recent presidential election that we've had. About 19-20% of the population fall into this group. This cultural creatives are, this group is about 25% of the population. And so these are people that are really into self-actualization, authenticity. They like exotic food. They're out there eating a lot of sushi. Nature, spiritual relationships are important. And that's about 25%, as I said. But then the biggest group in our country is what's called moderns. And so these are people like the latest trends. They want choice. They like innovation, technology. They kind of see the body as a machine, really into science. And so that is kind of the largest group that's out there. But I thought this was real interesting stuff, and it's kind of interesting to look at ourselves in this process as well. Now, this is a diagram that's not in our text, but I thought that it was, it's an important concept to understand. Satisfaction is driven by expectations. And so think of someone tells you that a movie is just great, awesome. And so you go to the movie, your expectations are so high, and the movie's good, but it's not great. Well, you're going to be dissatisfied because you were looking for great. If you go to a 4 or 5 star restaurant, you're looking for great, not for good. And if it's just good, the service is good, the food is good, but it's not great, you are not going to be satisfied. But if you walk into some dive down the street and your expectations are minimal and the service is good and the food is really good, you're going to be really highly satisfied. So part of what we have to do as marketers is to manage expectations. We have to educate our customers on what to expect, and so that they will come in with appropriate expectations. So for example, hospital food in many facilities is really horrible. And so if you can manage that a little bit, then you can improve that experience. But people come in kind of thinking that that's something that they know how to evaluate. The hospital I worked in New Orleans, we had a New Orleans chef, and if you've been to New Orleans, you know how great the food is. And that hospital food was actually pretty good. Now, as a little bit different emphasis, if our customer is an industrial customer, then their decision making is a little bit different. And even as a hospital, we will have this. When I was the VP of marketing, we set up an occupational medicine program, and so I hired salespeople to go out and sell those services directly to area businesses. If it's physicians, if we're selling physician services, that too is a little bit different. So some of that, their buying behavior is a little bit more sophisticated. There may be contracts involved. There may be negotiations. So to the extent that you can be effective as a negotiator, then that will help you in your marketing too. And you have this buyer-seller relationship, and it might be an ongoing relationship. So this is dependent to some extent on the frequency and the complexity of the decisions. But in addition, there may be different people involved. And so there's a whole list of people that may be involved in making this buying decision. And so there can be people that are influencers, that may be different than deciders. This is where your networking comes in as well. And so if you're someone that has any interest in going into pharmaceutical or device sales, then you'll see how all this comes into play. And so, for example, when I set up the sales program, we were selling our hospital services to physicians as well. And so I hired a very personable, very well-known nurse who was a nurse educator and had trained a lot of the nurses that worked in the physicians' offices. And so she knew the doctors, she knew the people in the offices, and she was extremely effective. And we paid her more than most head nurses were making, which didn't make them particularly happy. But I tracked the results, and in her first year, she brought in over $3 million of incremental revenue to our hospital. And so that's just my argument on that. It's like, can you argue the same thing? But so you need to understand that industrial sales, and that can also mean insurance sales as well, are a little bit different. All right, so we're going to transition now to how do we know what our customers want? So this is chapter 5. This is marketing research. And once again, how do we know what our customers want? We ask them. So what we're going to be looking at here is what are the variety of ways that we ask. And so this is the marketing research process, and it has several stages: problem recognition. What are we trying to accomplish with this research? You need to understand that before you ever start designing any questions. Then you'll do the research design, collect the data, and analyze the results. So this describes it as a six-step process, and this is what you'll be doing for your project here. So what is the problem you're trying to solve? What are you trying to accomplish? Then what is your design? And then you're going to collect and tabulate the data, interpret the findings, and then you'll have some report that you usually write. So let's look at that in a little more detail. So first, defining the problems, who are the stakeholders that'll be involved in this phase. And it's not just a symptom, but you need to be specific. The more specific your problem identification is, the more specific your survey will be, and the better information you will get. So what are our objectives? So are you trying to explore things, describe things, test a hypothesis, or be predictive in terms of forecasting demand for a service? So this is basically, this is stuff that you saw in research class, statistics class, and in this case, we're just applying it to the marketing setting. Now, the research design, we're going to look at some options here. So this is your plan for the entire study. How are you going to analyze and interpret results? And we're going to talk about this in a little more detail, primary data or secondary data. And then we have to figure out all the people that are going to be involved in this. Now, one of the things that I will mention is oftentimes if you're working for a hospital, for example, or even a large medical practice, you may use professionals in this, and you may use an outside company to do some of this. So you wouldn't necessarily be doing all of this yourself, but you could. So primary data, what is primary data? What do we mean by that? So what we mean is, this is where we're asking people firsthand, okay? And it can be qualitative or it can be quantitative. So we will look at each of those. It's very costly and time consuming. As you will see just in this brief project you're going to do of going out there, you think it's simple, and then you will see after you try to do it that it's not so simple, and you're only going to ask 10 people. So when we look at these different kinds of ways that we can get information, and so we're probably familiar with these telephone surveys. Probably those are very hard because nobody answers the telephone anymore. So we're screening everybody. But it could be you're very familiar with this internet surveys but it can also be mail surveys. Could be experimental research that we do in healthcare. But let's talk about focus groups a little bit. And so why would you do a focus group instead of a survey? So let me give you an example. Back in my experience, we looked at our data because we did a lot of looking at our data and analyzing who used our services and who didn't. And one of the gaps that we found is not as many African American women were getting mammograms as would be expected. So we wanted to know what that was about. So if we could send them a survey, but if you do a focus group, which is basically you bring a bunch of people in a room, maybe 8 to 10 people, you may conduct 3 different sessions, and you have a series of structured questions that you ask the people. Well, the benefit of that is you can drill down a little bit and get nuances and a little more detail. You can probe, you can ask them, well, what do you mean by that? And so we did these frequently too at the hospital. I used a professional most of the time. Sometimes I did it myself, but we took them into a research facility with the 2-way mirror. So I was sitting behind there watching the whole thing. But we used professionals, but sometimes I did it myself. And in this particular instance, I brought in a number of African American women and was probing the question of why they didn't get mammograms. And there were 2 themes that emerged from that. The first was they thought they were painful. And so, we realized that in our promotional campaigns, we needed to use like testimonials of women who they could identify with that were saying, I did this, it was quick, easy, and it was not painful. The second thing that came out was they didn't want to have the mammogram because they were afraid of the results. The results were so fearful to them that they would just rather not even have the procedure. They did not want to know. So once again, we could incorporate that into our communications plan of I had it, it was easy and simple, I'm so relieved now, I'm so glad I did it. So this is how you use research to craft the communications that we'll look at much later in the course. But the other thing that we found out is we were doing mammograms 9 to 5, Monday through Friday. And these were professional women, they were working women, and people were like, I can't go. I'm not going to take a day off work to go have a mammogram. So we extended our hours to after work hours. We had some Saturday hours. And so that's just an example of how you can use a focus group to find out information like that. So once you have your research designed, you've got to figure out who it is that you're going to, where you're going to apply it. So that's what's called your sampling frame. And so how are you going to find these people and how many of them are you going to interview or survey? And then we got to design the questionnaire. So you're going to have some fun doing this. As with many things in life, one of my number one rules, and this is so true in marketing research, keep it simple. Keep it simple. You have got to also be very clear as to all the terms you use. Are they terms people will understand? And that's why really what you're doing is what we would call a pilot, where you're going out and doing a pilot test on a survey. And so people can give you feedback and say, I don't even know what this means. I don't understand this question. One of the common mistakes is people will really be asking two things in one question. You cannot do that. No ands, no ors. Okay, one thing in every question. But there are a lot of different ways that you can ask the question. You can do open-ended questions. Yes, no, doesn't provide too much information. I am a big fan of Likert scales, and we'll see that in a minute. So when you think of the student evaluations that we do at the end of every term, stuff Dr. Lane sends out to find out what you all are thinking about. So these are examples of, so I'll tell you the truth, I help her design those. So this is what we're talking about here, and we're kind of familiar with those. So with the primary data collection, it can be quantitative, experimental, survey research, as we've said. And so you're going to go out and ask the people that directly. There's a couple of different types here. So one is an attitude survey. This is a survey we were doing of our undergraduate students. And so we were asking them what they thought different factors were. These are actually competencies in the program. So how important are each of these things to your career? So as you can see, we're using a five-point Likert scale here. And so they can say, well, this one's important. Business knowledge, yeah, that's really important. Skills important. Communication, not so much so. And so you're going to get this quantitative information just like the student evaluations. And so we can say, okay, on professionalism, the average is 4.2. On communication, it's 3. Now, with Likert scales, sometimes there's 7-point Likert scales as well. So this is attitudes, and we use these a lot in the hospital as well. So we wanted to know how important different factors were to our customers and our community. Another type is satisfaction surveys. This one, ServQual, this is not in our book, but I wanted to throw it in here. And so this asks customers about first their expectations, like how important do you think these different factors are? So here's a whole list of things that we might ask about. Then we measure how good were they at this. So how important is it and how good was it? So let me just give you an example. With satisfaction, we measured all types of satisfaction in the hospital. And so the food, the cleanliness, the response to the call light, the politeness of the housekeeping, all those kinds of things. But the thing that was most important in to our hospital patients was the nurses and the way the nurses treated them. So did they respond to them promptly, and were they courteous, and did they appear to be competent? So the housekeepers were fine, good, but it really was the nursing care that drove overall satisfaction. So this can help you uncover some of that. This is a simple example of a satisfaction survey. We're all familiar with this. So for all of these factors here on this 5-point scale, how satisfied, dissatisfied were you? And so the ServQual stuff kind of dictates some of the things, but you may in your, say you're managing a physician practice, you may use an outside service, or you may design this yourself. So these would be examples here. We also, another group that we always surveyed, we didn't do it too often because it created its own expectations, but we also asked employees what their satisfaction. We were careful in doing it because when you ask people what they think and then you don't do anything about what they think, then they're more frustrated than ever. So you want to be careful with that. Don't ask things that you really don't want to know. Another type is need or demand. And so we surveyed our community every couple of years. And so how likely are you to use all these different services? And so that helped us to do our forecasting for our services based on that. All right, so marketing research, there's different ways. This was qualitative ways. That means there's a number associated with it. There are other ways that you can get primary data collection as well. And so one of them is observational, mystery shoppers. We actually had a fake patient in the hospital as a mystery shopper, somebody from the outside. And our nursing staff was not too happy about that. They thought it was somewhat unethical to have a fake patient. But just stayed overnight, one night, very insightful as to what really happened. I have never been a patient in a hospital, so that is a disadvantage that I have of I think I know what's going on there, but not necessarily. So we've talked about focus groups, but you could also do personal interviews. So instead of doing these in a group, you can do it one-on-one. And now we're using a lot more social media to see what people think too. So that's an emerging way, but there are questions about that of whether the people are real. So just a way to be cautious about that. So after we get all this information, we're gonna load it into some way to analyze it. If we've got quantitative information, so some of the softwares are Excel, SPSS, or SAS. But if we are doing qualitative, we also have to write up a report, and we have to come up with themes and group things. And so there's a lot more bias involved in qualitative. You know, what did they really mean by this word? Are these two words the same word? And so that is one of the challenges of qualitative research. And then we have another source, our last source in our last slide here is secondary data. So I'm not going to go into this a lot because you have a whole class on informatics and analytics, but there is a lot of data, Medicare data, MedPAR data, for example. And so there's information that we can buy from other sources. We can mine it from our own sources. And then analyze that. And certainly big data is a big part of that in data mining. And it can be something as simple as the census. It could be something as simple as a community needs assessment that's part of our way to defend our tax exempt status. And so there are a lot of different sources. It can be stuff that's out there from the Chamber of Commerce. So there's all kinds of secondary data that we can use as well. And the other thing is we may actually buy comparative benchmark data. So for example, with our patient satisfaction data, we participated with a group of hospitals because we want to know not only how are we doing over time. So remember, that's internal benchmarking. Our overall satisfaction was 4.2 in 2016, and it's 4.3 in 2017. Yay for us, we're doing better. However, if we buy this external data and we see, wow, everybody else is at 4.5, even though we improved, we're still not doing as well as our other external benchmarks. So you want to participate in those as well. All right, so hopefully this gives you some idea of how to find out what's on your customers' minds, what it is that they want, and why they do what they do.